Thank you for being here today, Director Chapalavia. Now, Director Chapalavia, you would agree that the highest possible safety standards should exist in our veterans' homes, correct?
Absolutely, and we're held at different standards than any other nursing long-term facility in this entire state. We're directed under the federal government, the VA, federal VA, and IDPH.
All right. Now, back in April, you said our facilities are prepared for COVID-19. If cases do occur, we will work with the guidance from the Illinois Department of Veterans Affairs, our local health officials to isolate hospitalized residents as appropriate and protect other residents and staff from transmittal, correct?
That's correct, ma'am.
All right. So you committed that the organization you lead, which includes the facilities not only at LaSalle but also at Quincy, to following the required steps to protect residents and staff from transmittal, correct?
Correct, ma'am.
All right. Do you have any understanding as to whether any individual at any of the facilities in your department were not following IDPH guidelines?
That is what the investigation was called for, Representative, so we can make sure that we get to the bottom of all those things. Also, one thing that you had added earlier, and I want to make sure that I make this very clear, and I'm going to be very general about this, is that every one of the residents that we care for, all those heroes and sheroes we care for, their families have the ability, the directives. So I can't force anybody who is ill to go to the hospital that we serve. I can't force anybody who only wants comfort care, their family's directing comfort care, to go to the hospital. If I have a vaccine for their cure, I can't force them to take a vaccine. We are a nursing home. We are the last step for our amazing veterans for care because their family are unable to, or they're at the stage they cannot, whether they have dementia, they need that care of the nurses that are certified.
Sure, I get it. I'm going to cut you off. I'm really trying to get at factual information instead of speechifying. So let's jump into what recommendations did the Illinois Department of Public Health provide or not provide that you believe failed these residents?
That I cannot say that. That's not for me to discuss that. You would have to ask the department.
No, I'm asking what information did they give you that was either sufficient or insufficient to prevent the outbreak or outbreaks?
There is long-term guidance for all of the long-term care facilities that we abide by.
Right, and you believe that where the outbreaks occurred, each and every one of those IDPH guidelines was being followed to the letter by every member of staff, by every employee.
That is the expectation, and that is why we've called for the independent investigation on our department.
Right, but do you know today whether people were actually complying with those IDPH guidelines?
We would hope that they have, and that is why they fall under administrators that are licensed and other employees there that are licensed, like the director of nursing, ma'am.
Are you aware of any instances where employees previously to this outbreak had to be reprimanded for failure to comply with IDPH guidelines or any of the existing policies and protocols that might contribute to disease spread?
I am not aware of any specific cases, Representative.
Well, I'm really concerned to hear you say that because even in the documents that you produced to us, there were instances, for example, where it was reported that staff members were allowing soiled briefs to be combined with linens and that you were at risk of losing your linen service because this was absolutely inappropriate. And as we know from many of the briefings from IDPH, fecal matter is one of the highest ways in which you can have transmission of the COVID virus. So what's your answer to that?
I'm sorry, ma'am, I do not know the document you're talking about.
It's one that you produced to this committee. Have you reviewed all the documents that were provided to this committee in preparation for this hearing?
There are over 1,600 documents right now that we provided to the chairman.
I know, I reviewed them all.
Well, I have not personally looked at every single one of them, ma'am.
Well, have you looked within any of your records at the Quincy or LaSalle facilities for you personally to try to identify where there might have been some problems, where protocols were not being adhered to?
That is all under investigation, ma'am.
So you basically outsourced your own independent oversight authority to the DHS investigators?
No, I'm making sure that we have an independent set of eyes outside of my department so we can get down to the bottom of exactly what happened and transpired across the whole entire department.
Well, why don't we have your skilled set of eyes looking at all of these things? Because that jumped out pretty quickly to me as that was a problem. And there's a whole other laundry list of things that is part of the review that I saw early on. There were clearly some potential red flag problems. And I want to know if those practices were actually continuing at around the time frame of this October-November outbreak.
As you know, ma'am, when I first took this position, we were under an executive order 1904 by the governor to make sure that we come up, that investigation came out with a lot of individual things that this department had to correct. I have not been with this department more than 2 years. And it took me 10 years to learn elementary and secondary ed as a chairperson and another 5 to learn appropriations. So that's why our department has hired licensed directors of nursing, hired licensed directors of administrators. We have contracted PAs, doctors, facility-wide. We have certified people that should be doing what they need to do, and they are all regulated, like I said, under CDC and IDPH and local health departments. So they have the inspections. We have never dealt with this before. Novel coronavirus 19 is called novel because no one knew what to expect. We were still running under all the protocols of keeping our men and women safe.
Sure, but I'm seeing instances in your documentation where there's records of people who are violating the protocols. And another one that Chairman Tapetti brought up earlier, for example, is that individual residents didn't have sufficient soap or toiletries to be able to clean themselves. Is that accurate or is that not accurate?
That is not true, ma'am. That is misinformation out there. Each of our veterans have soap and toiletries. If there is a specific brand that they want, then that is worked on through the administrator and the staff there, the social services staff, to get them what they need, whether it's donated and we're able to get it to them or not. So that is not true. All of our residents have toiletries and are kept very clean and healthy.
Well, that's not consistent, though. Your representation is not consistent with the consultative infection control visit to the Illinois State Veterans Home at LaSalle that's dated November 12th, 2020, because one of the things that they had identified is that there were some problems with cleaning protocols, there were problems with ventilation, there were staff management and infection control practices that were wanting. So, I don't know how you can say that you're convinced that people were fully compliant with guidelines when you've got a report that's come out already suggesting that guidelines weren't being adhered to and people did not have appropriate PPE. There was hand sanitizer that didn't have alcohol in it. Well, actually, let's go with that one. Are you disputing that that hand sanitizer that was on the site did not actually have alcohol in it and it was just benzalkonium chloride for many months?
That's all under the investigation that's happening, ma'am. But also we did have other hand sanitizer there that was recommended by CDC with the alcohol content in it.
Let me interject for one quick moment. I want to make a record that we've been joined by a few representatives-elect. Thank you for joining us this morning. Chairman Kifowit is here as well. I don't think that I've missed anyone else. But I would like to ask very quickly while the line of questioning continues, Director Chapelavia, who is the person with the most knowledge about the activities occurring at the facility from October the 18th, 2020 to November the 1st, 2020? Clearly it's not you. So who is it?
That would be the administrator that we have let go of.
Okay, was there somebody, did she have a chief of staff that she worked with?
Sure, yes.
And who was that individual?
That was my chief of staff, Tony Colbeck, sir.
And he's on the line as well, correct?
Correct, and so is IDPH.
Okay, so perhaps we may want to consider getting him on the call and let's see his face. And when questions are posed, if you're unable to answer them, Director, perhaps maybe you should defer to your Chief of Staff to answer that question, because we're not getting any answers. And it's getting a little frustrating. We get either very direct questions, they're very simple questions. This is a fact-based investigation, and we're being stonewalled.